The biggest diseases were dysentery, typhoid, and pneumonia. Dysentery has a side effect of severe diarrhea with the passage of mucus and blood. It is caused by E. coli and salmonella. Typhoid is an infectious fever that has red spots on the chest and abdomen. It is also caused by salmonella. Pneumonia is an infection that inflames the air sacs in the lungs and is caused by being exposed to many different germs. Amputations were one of the biggest medical problems in the Civil War. Infection happened after most, killing a lot of people. Bacteria played a major role of the loss of soldiers by not having proper medicine. More soldiers died from diseases than anything else during the war. The biggest medical advances were accumulation of records, development of systems, managing mass casualties, a new style of hospitals, treating wounds right away, sanitation, and training experience. The first antibiotic was penicillin. Alexander Fleming discovered penicillin on September 3, 1928. Penicillin is important because it was the first antibiotic to treat a disease and prevent infection. Another war that benefited from penicillin was World War II. Penicillin is used by taking an oral injection, IV, or intramuscular route. Penicillin had an important impact that was positive. It saved many lives by treating an infection. Hand hygiene became common in the 1970s. Hand hygiene is important because it reduces the risk of infections by removing dirt and oils. Antibiotics work by blocking bacterial processes, killing the bacteria and stopping them from multiplying. Antibiotics are important because they stop viruses and kill bacteria. Glycosides kills pneumonia and typhus. Penicillin kills UTIs and gonorrhea. Cephalosporins kills strep throat and bronchitis. Peptides kills gastrointestinal infections and respiratory tract infections. Tetracyclines kills chlamydia, syphilis, and also mild acne. There are many ways to prevent bacterial infections, like washing hands, avoid touching your nose, eyes, and mouth, disinfect everything really well, and use antibiotics properly.
Good bacteria is known as probiotics. Lactobacillus, streptococcus, and Bacillus coagulans. Lactobacillus helps digest food. Streptococcus helps with abdominal cramps, diarrhea, and nausea. Yes, we can live without the good bacteria. Antibiotic resistance is a natural phenomenon when antibiotics have a greater chance of survival than those are susceptible. We should be concerned about antibiotics resistance because it does not work for viral infections. They mostly work for bacteria, such as strep throat, whooping cough, urinary tract infections. Things that will not work are cold, flu, runny nose, and sore throat. Antibiotics resistance occurs when bacteria change in some way that reduce or eliminate the effectiveness of drug, chemical, or other agents designed to cure or prevent infection. The bacteria survive and continue to multiply, causing harm. Bacteria can do this through several mechanisms. Ways to prevent antibiotic resistance is to not use leftover antibiotics that you used the last time, and do not take antibiotics for every little thing. Antibacterial containing products has been not proven to prevent the spread of infection better than products that do not contain antibacterial chemicals. Although a link between antibacterial chemicals used in a personal cleaning products and bacterial resistance has been shown in vitro studies. Some common bacterial products would be Lysol and soap. There are a variety of probiotics that have been studied for various health benefits. Their role in preventing drug-resistant infections in humans has not been established. CDC is currently monitoring research on probiotic use but cannot make any recommendations at this time.